Clinical research is an absolute essential step in bringing advances to patients, and it's often the most difficult step. It's often the step that tends to hold up the progress of advances in cancer treatment. Yes, of course, we were working before, we were working in groups, but the huge difference with NCRI was the size of the vision and the fact that this was to be a really comprehensive setup, so that we would be in a situation where every sort of cancer had a home and a group of people with experts from around the country who were going to be able to work on clinical research to make that happen. If we look at what was going on in cancer research before the NCRI was set up, we were doing important work, but quite a small amount. And in fact, when we look at the figures, we can see that maybe 3 or 4% of patients with cancer were going into cancer trials. And if you look at what happened in the years from the setup of the NCRI, there was this astronomical expansion in the amount of research that was happening in the UK in cancer. People were looking at what was happening in the UK and saying, isn't it fantastic? You've got this fabulous system for developing trials and then for making sure that those trials actually take place. Cancer research really requires all sorts of different visions. We absolutely require new treatments to be developed. At the same time, we need an enormous amount of work to make sure that we're using the treatments which have already been developed to their very best advantage. And very often, the optimization of the advances is something which the rest of the world hasn't been terribly good at. And I think where we've been especially good in the UK and really quite distinct from other countries has been in the way that we've been able, through the NCRI, to bring the patient agenda around the table. There are very few places around the world where we have patients sat around the table with scientists, with clinicians, with statisticians, and together deciding what the questions are that they're going to be asking and designing the trials to make sure that those trials get answered. And I think that's something which the NCRI has brought a really distinct flavour to.